Yeah, just a quick review of the Sujayu knee brace. So this brace is made specifically for people that are having some type of knee problem or having a lot of knee pain. And the idea here is that you put on the brace and it supports the joint and surrounding soft tissues, like the muscles around the knee, and it restricts your knee motion a little bit. So that way your knee has a chance to rest, recover, and it doesn't get so overstressed as you're doing things. So a few points about this particular brace. It does fit either the right or the left knee, so be aware of that, which is actually really good because let's say, your right knee's bothering you and you wear it for a while and then it's fine. And then later on down the road, your left knee bothers you. We don't have to worry about buying yet another, brace. You can use the same one. So I think that's good. Know that this is one size fits all. Okay, so you don't have to measure anything. Just one size fits everybody. And it does come in 4 different colors, which I think is kind of cool. Most of the colors you see are like black or gray or something. But this actually has a couple other interesting colors. So anyway, other things you can do if you're having a lot of knee pain, just getting this from like a Bulletproof Your Knee. Basically, if you have any kind of knee problem, any knee pain, make sure you're doing at least one exercise to strengthen your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg. Now there's your kneecap right there and right above it. It's made up of 4 muscles, but collectively it's called the quads or the quadriceps muscle. So what researchers are finding now when they take a look at people with various knee problems and they test all the muscles around the knee, they find basically it's just the quadriceps muscle that's really weak in a lot of conditions. So for instance, like knee swelling in the quadriceps. This is interesting. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, is enough to decrease the strength of your quadriceps muscle. So if you have any kind of acute or chronic swelling, probably is taking its toll on your quadriceps muscle, making it weaker. And might I add that the quadriceps muscle is the big stabilizer of your knee. Knee injuries in the quadriceps. People have, maybe fractured their lower leg bone, like their tibia, surgical opening of the knee. So if you've had knee surgery in the past, it puts you at risk to have decreased quad strength. Ligament problems in the quadriceps. Here's the anterior cruciate ligament, also known as the ACL. You've heard of football players tearing their ACL. So this is interesting. One study looked at people who completely ruptured their ACL. Researchers found that the strength of the quadricep muscle in the injury leg was decreased by 25 to 30%. So here again, you're taking a muscle that's a big stabilizer of the knee. You're knocking down its strength over 1/4%, 25 to 30%. It's going to be hard to get better and get pain-free unless you get that strength back up. Same thing with the posterior cruciate ligament, medial collateral ligaments. Knee pain in the quadriceps. They find that people have knee pain kind of decreases their quad strength. Here's an interesting knee arthritis in the quadriceps. So if you Google like knee arthritis and quadriceps, you're going to find that it's very, very, very consistent in the research that if you have knee arthritis, you probably have weakness in your quads. And so, interestingly, randomized controlled trials also show that if you take a group of people with knee arthritis and you you strengthen just their quadriceps muscle, that their knee pain starts to go away. And some of these studies are even showing that the people that have the strongest quads have the least progression of their knee arthritis. So you got a lot of reasons there to strengthen your quads. Patellofemoral pain syndrome. Let's keep going on and on. So you have any kind of knee problem, make sure you're doing at least one exercise for your knee, for your quadriceps muscle. Fine-tune control over your knee. Well, here they're talking about the hip. So a lot of times you can have really bad knee pain. There's absolutely nothing wrong with your knee. The problem's up at the hip that's causing the problem. So classic cases like iliotibial band syndrome. Take a group of people with iliotibial band syndrome and you muscle test their hip muscles. And you find they have usually weak hip abductors. That muscle keeps your pelvis level as well as brings your leg out to the side. So here again, just like with knee arthritis, take a group of people with iliotibial band syndrome, and these are randomized controlled trials. Strengthen their hip abductors, and the iliotibial band syndrome starts to go away. So, isn't that interesting? Optimize knee flexibility. We all know that your knee should be able to bend and straighten sufficiently. A lot of people don't know is that your knee actually rotates. So about the last 10 to 15 degrees of extension, that's you straightening your leg out, your knee actually rotates laterally or out to the side. And here's a little test to see if you have that motion in your knee. That's an accessory motion that actually a normal knee needs for normal functioning. Increased knee dynamic stability. So here we're talking about proprioception. Proprioception is your position sense. So like if I suddenly turn the lights out, you'd probably be able to tell me whether your knee is bent or straight. And that's because you have receptors in the knee and the surrounding muscles that constantly give your brain feedback as to where your knee is in space. Problem is, researchers are looking at people with various knee problems, and they're finding that their proprioception just isn't what it should be. Now it's not like these people don't know where their knees are or anything, but it's just not really it's not normal, which can cause problems for you. Like for instance, like reaction times. That's why they're talking about, I guess, the dynamic knee stability. Let's say you step off a curb unexpectedly or in a hole. You need to be able to know where your knee is instantly, so that way you can contract your quadriceps muscle before you have damage. So anyway, lots of other things you can do. But hey, nothing's as quick as putting on a brace. This is a pretty easy one to use, so check it out.